All right, we have TEG or thromboelastography or rotational thromboelastography or measurement. The way that this is done is there is a cup with the patient's blood and a rotational pin inside. And it as the clotting process happens, it becomes more viscous and causes more force on this pin, and that is translated into a tracing that shows an amplitude for this axis, and then the x-axis being time. As the blood is just introduced, it's liquid, very viscous. But then once the clotting process starts, then there is a slope. And then eventually the time is, there's a lysis process. Well, this is a 3D process happening on a 2D tracing, essentially is what this is, okay? And so you have a time before the clot starts, which is our time, okay? This is time until it starts. All right, what is the primary coagulation factor item here is clotting factors. If this time is delayed or prolonged, that means that you have a deficient clotting factors. So you have low clotting factors. And so what you need to do is give the patient FFP. And the normal time for this is approximately 5 to 10 minutes. Okay. So once this starts, then you have a point where this clot is at its max. Okay. Or max strength. And this is called your K. Okay. Or your kinetics. So K is the time or kinetics where this is to max clot strength. The primary item or factor here is fibrinogen. So if your K is up or prolonged, then what that means is that you have low fibrinogen, or it's not working. And what you need to give these patients is cryoprecipitate. And normal values for this is anywhere from 1 to 3 minutes. Okay. What you also have is the acceleration of this formation. It's called the alpha angle. Alpha angle. And this just represents the acceleration of clot formation. Okay. This is also a measurement of fibrinogen function. And so then if your angle is low, what that means is you have lower fibrinogen or function. And what you need to give these patients is cryoprecipitate. And a normal range for this is anywhere from 50 to about 70 degrees. Okay, so any lower than 50 is when they need cryoprecipitate. Next is what's called the maximum amplitude. Okay, this is a measurement of strength. So this is clot strength. The point at which the clot formation is now, at least the process of clotting is now less than the process of fibrinolysis. So this is representing coagulation. Now this is representing clot lysis. Okay. So back to maximum amplitude. Again, the strength that's at the very peak of coagulation at the point where then lysis then becomes predominant. This is a function of platelets. So if you have a low maximum amplitude, that means there's something wrong with the platelets or their function or quantity. for quality. Okay, so what you give for these patients is platelets. And a normal value for these is 55 to 75 millimeters of clot strength is their unit. Now, on the lysis end, you have a measurement called LY30. LY30. Okay? This is the point at which, after 30 minutes, so your percent lysis of the clot after 30 minutes from your maximum clot strength. Okay? So if this LY30 is elevated, what that means is there's too much fibrinolysis. Okay, so what you need to do is give them TXA, tranexamic acid. And the normal values here are about 0 to 8%.